Okay, guys, thank you so much for being here. We'll start طوالي. So what I did, I was basically explaining the basics حق anatomy of the eye. Um, but I think I'm gonna go straight into the topics عشان ما ناخد too much of your time, okay? So topics mainly الحاجات دي anatomy of the eye. I don't want you to focus too much on it. What's important is a few things I'm gonna point out حس سريع for you guys that are super important to establish. Um, can you guys hear me? I'm sorry, the internet is so bad right now.
أيوة.
Okay, great. طيب thank you. So عندنا حاجات مهمة is that أول حاجة conjunctiva is divided into two parts. عندنا bulbar part which covers the eye palpebral part that covers the inner lid. Conjunctiva is also supposed to be clear with blood vessels on it لأن هي the blood supply of the cornea. تمام؟ And its function is to protect the sclera with the cornea extraocular muscles. So it's a protective function. تمام؟ عندنا تاني السكليرا it's the white part of the eye and لما تصل near the lens or near the iris it switches, it's no longer white, it becomes the cornea. The cornea is transparent and it consists of a lot of different parts. في epithelium والepithelium it's for generation and healing, and if you hit the stroma or the basement membrane or the endothelium or any of these it'll heal by fibrosis and not be clear anymore. Again, it has to be transparent to be normal, okay? It's an avascular organ, so it doesn't have a blood supply, and it takes its blood supply from the conjunctiva. And that's why you can transplant the cornea without any issues with that rejection or anything like that. It slightly helps in the refraction of the light, but it's not the main. The main person is the lens here, okay? The iris, it's the colored part. It dilates and constricts the pupil, تمام? And the pupil has two conditions ممكن نقول. Contraction causes meiosis, dilatation causes mydriasis. These are two conditions you need to be clear with لأنه الفوكابulary بتيجي كتير. The lens is also avascular, and when it's not there, we call it aphakia, and when it's artificial, we call it pseudophakia. تمام؟ الفانكشن حقت lens is accommodation, which basically means that its job is to put the light or let the light reach the retina. تمام؟ In the ciliary body والchoroid, I'm not going to talk about them much. A ciliary body is basically muscles that help stabilize the lens. Choroid is a vascular blood supply برضو. Our retina is the nerve part. So it's a lot of nerves. It's formed of 10 layers. Not important that you know them now, but they have photoreceptors, and there are two, the rods and the cones. The rods are more numerous, so there are a lot of rods. The rods are sensitive to light, and they're only working black and white. معناته شنو؟ The rods بيشتغلوا when there's not that much light. ليه؟ لأنهم they have a higher sensitivity to light. And when that happens, they can see in the dark, but they can only see black and white. And that's why in the dark you can't see colors. لما يكون الوقت مظلم you only see figures and things, because that's when the rods are working. The cones are less, but they are less sensitive to light, so they need a lot of light to be able to work. And they can see in colors, red or blue or green. And that's why in day vision you can see colors. They are located في حتة اسمها الماكيلا. So الماكيلا is basically a location that has the highest number of cones, and so it's where your vision is the clearest or the best. An optic disc is where the optic nerve is. الحتة دي specifically ما فيها rods or cones, so it's a blind spot. So in simple words, عندنا في الretina two important spots. الماكيلا أو الفوفيا, these two spots, important ليه? Because they have the highest number of cones and it's the clearest vision. While the optic disc, its issue is that it's a blind spot, you cannot see in it. الماكيلا, so it's so important for us to have good vision is that the macula and fovea are working normally. حصلت أي مشكلة في الماكيلا, your vision and the quality of your vision and your ability to see color are going to get affected. فهمتوني؟ طيب عندنا segments of the eye. The segments are basically anterior segment or posterior segment. Each segment has a specific body of fluid. عندنا aqueous humor في anterior, عندنا vitreous humor في posterior. Okay? An anterior segment is divided into two chambers, anterior chamber or posterior chamber. An anterior chamber from the cornea to the iris, والposterior chamber from the iris to the lens. Someone's not muted. Can you guys make sure you're all muted? طيب في تاني extraocular muscles that you guys know already from anatomy, the ones that are like they work with like nasal oblique and the rectus muscles, and these ones are responsible for movement of the eye. عندنا كان eyelid فيه palpebral fissure وفيه sebaceous glands and فيه sweat glands برضه اللي هم اسمهم gland of Moll. Okay. عندنا lacrimal system which is the tear system. A lacrimal gland بتشغل tears and then they get drained into the lacrimal puncti which forms canaliculi which go into the lacrimal sac and eventually it goes into the nose. These are just very quick stuff on the basics of the whole thing. نخش في details اللي هو the things you're actually supposed to like really focus on. تمام? And if there are any problems guys just write on the chat. تمام? So أول حاجة عندنا refractive errors. Refractive errors are problems with the refraction of light, meaning that these are going to affect your vision quality. تمام? And they're very common in whom most people who are wearing glasses probably have one of them. تمام? عندنا myopia. Myopia is nearsightedness. So, okay, nearsightedness. It's that blurry vision if something is far. But if it's near, it's clear. So, near sight. They can only see الحاجات القريبة. So, البعيد ما بنشوفه. What happens is that light gets focused on a single point before entering the retina. And normal is إنه light يخش. Let me put a pointer عشان يكون واضح. Sorry. Yeah, okay. شايفين the pointer? So basically the normal thing is that a light, when it all connects into one dot, that happens inside the retina. If it doesn't happen that way, you'll have problems with vision. So with nearsightedness or myopia, a light بيعمل connection before it reaches the retina. And that's why far things, you can't see them. If something's near, that'll correct itself. Okay? What happens is we correct it with a concave lens, so glasses are concave. تمام? Super important you know these things تحفظوهم because they come in the exam كتير شديد. So myopia is المشكلة is that the light gets focused on a point before entering the retina. It's corrected with a concave lens. عندنا hypermetropia. Hypermetropia العكس. Farsightedness. Farsightedness is that blurry vision للحاجة القريبة. But far is clear. And هنا المشكلة is the light gets focused on single point beyond the retina. So a light actually would get focused bad. It misses the retina. And what happens here is that we give them a convex lens. So the difference between myopia and hypermetropia, you have to know it. تمام? يعني myopia, near sight, you can see what's near because a light gets focused before the retina. While hypermetropia, farsightedness, لأنه light gets focused after the retina. في astigmatism. Astigmatism is when there's an abnormal curvature of the cornea, and because of that, light doesn't even connect in one point at all. It has lots of points. So we end up with a lot of points, and they're on different parts of the cornea, or of the retina. So بيكون الزول بيشوف lots of scattered, their vision is very scattered and confusing. بيشوفوا lights very weird, okay? Like, you know how when you're driving at night or you're going at night and you see the lights بتكون مشخشخة كده? That's how they see things. So they بنعمل لهم correction with cylindrical lens. So if you can see here, there's more than one focal point. في presbyopia. Presbyopia is age-related, and it's similar to hypermetropia, لكن it's not already there. It happens by age. What happens is that they can't focus on near objects. So they can see what's far, but they cannot see what's close, and they just need reading glasses. So يعني الفيجن العجايز is not hypermetropia, it's presbyopia, which basically إنه elasticity is lost. While ناس hypermetropia, their eye is, the shape of their eye is wrong أساسا. They cannot see what's near, and it happens to even young people. Okay? So this is super important. What happens to old people is presbyopia, which is that their eye is, the lens is just less elastic. It's not that the lens has, or the eye shape is wrong in the first place. تمام? Any questions so far? طيب. عندنا تاني squint. Squint is basically when the eyes aren't looking in the exact same place, or like there's an abnormal deviation of the gaze. عندنا common causes. Paralysis of the extraocular muscles. So اسمه paralytic squint or strabismus أو sorry, I always hate this word, amblyopia, which basically means the disuse of an eye. So like when one person is not using one eye as much, they're focusing on only one eye, بيحصل slight squint as well. There's a lot of types of squints, horizontal or vertical. These are examples of the pictures. إنه horizontal squint is that inwards or outwards deviation. والvertical squint upward or downwards deviation. Horizontal squint إنه مسامي esotropia لو inwards و exotropia لو outwards. الvertical hypertropia لو upwards و hypotropia لو downwards. So the things that are important إنه it's uniocular أو alternating. في type that's called alternating, which means that whenever you fix one eye or you cover one eye, the other eye gets corrected. لكن when they're together, they can't work. So what I mean is, if you guys did like you did the examination حق ophthalmic examination, you'll notice في حاجة اسمها cover uncover test. So when you cover the eye, the other eye بتشتغل normally. لكن the second you're looking with both eyes بيحصل squint لواحدة منهم. دي alternating squint. And uniocular squint is that one eye has a problem regardless of what happens to the other eye. So يعني لو حصل paralysis في let's say one eye, even if you cover the other eye, nothing changes. But لو عندكم another cause of or another cause of the squint, even if you were to cover, when you cover the one eye, ممكن التاني تتصلح براه because the issue بتكون issue بتاعت coordination. Okay? So these are the two options. Either يكون alternating squint, meaning that whenever you cover one eye, the other eye fixes itself on its own, but whenever you look by both eyes, بيجي السكوينت بيظهر. Or تكون the problem is only with one eye, and it's just that this eye has the problem regardless of what happens to the other eye. في symptoms بتيجي مع السكوينت, mainly diplopia or double vision, eye strain, headache. Some people have burning sensations, like the eye that's squinting hurts them, or they have lacrimation or like tearing in one eye. And the diagnosis بيحصل بالcorneal reflex وبالcover uncover test. Okay? So a squint is just like, mainly they'd ask you about the types of squints and stuff like that. There's not as detailed the questions حقت السكوينت. Eyelid abnormalities, super big topic, super important that you guys know very well لأنه بتيجي كتير شديد في الامتحان. عندنا position of the lids أول حاجة. إنه lids can be wrong in their position. عندنا ptosis, which is just drooping of the lid, and ده بيحصل with the third nerve palsy, Horner syndrome و myasthenia gravis commonly. إنه الحاجات دي كلها they make your eyelid drooping. So it's just a drooping lid. عندنا entropion, which is that the lid is turned inwards. Literally يعني شايفين الصورة دي؟ Let me try to zoom in. الصورة دي الليد itself مقلوب لجوا. Can you see it? The lid itself مقلوب لجوا. And that is entropion. And because of that, the lashes are also inside, and the lashes can really irritate the cornea. Eye. So the lashes are going to be irritating the cornea and the eye. And yeah, that's what happens with the entropion of the lower lid. Of the upper lid, it's most commonly due to trachoma. And trachoma is basically, what's the word? What's the bacteria? Chlamydia, yeah. Chlamydia trachomatis. It can cause trachoma or eye problems. And that's a bacterial infection which would lead to the inward going of the upper lid. So if you see entropion of the upper lid, it's usually associated مع trachoma أو مع chlamydia infections. Okay? الectropion إن الليد يكون طالع لبرا. It can cause some problems like preventing the drainage of tears, so it can cause like teary eyes, or it can sorry guys, or it can expose the conjunctiva to dehydration and irritation. So برضه بيكون في red conjunctiva. So entropion affects the cornea لأنه الlashes بتضرب على الeye, while ectropion, when it's turned outwards, would expose the conjunctiva to the direct environment. So these are the two problems. Entropion, lashes are going to hurt the cornea, or ectropion, where the conjunctiva is going to be exposed. Okay? And remember إنه البارت اللي تحت ده it's covered by conjunctiva. تمام؟ عندنا تاني trichiasis. Trichosis is that their eyelashes are the problem, not the full lid. The eyelashes are the ones that are up, they're not the correct direction, and they're directed towards the eyelid. And they have to be 5 or more. If there's 1 or 2 lashes that are downwards, that's not trichosis, that's just normal. 5 or more lashes that are downwards, their lashes are supposed to go outwards, they go downwards inside the eye. And the lashes will rub against the cornea as well and cause abrasion and irritation. So شايفين الeye بتكون very red. The lashes are causing the eye to be irritated. وبرضه the common cause is trachoma. تمام? So if the upper lids are entropion أو حاصل trichosis, in the eyelids our lashes are directed towards the eye, causing a red inflamed eye. The most common cause is trachoma. تمام؟ عندنا تاني inflammatory issues. So the eyelids can have inflammation. So الأول حكيت إنه بس مشاكل بتاعت position of the lid. الحاجة اللي تحت is مشاكل في lid itself causing an inflammation. عندنا أول حاجة chalazion. Chalazions are meibomian glands. إحنا قلنا إن sebaceous glands حقت eye are different. They're called meibomian glands. These can be inflamed. If it's inflamed, الحاجة دي اسمها chalazion. Chalazion is painless. تمام? It's a lid swelling that's painless. عندنا الستاي أو بنسميه external I hate this word so much, hordeolum أو sty. This is basically inflammation of the eyelid or hair follicle. So it's a hair follicle حصل لها inflammation, and it's like a pimple basically of your eye. This is a painful lump and it has redness. So they become inflamed mainly. And برضو so the difference between a chalazion and a sty أو hordeolum is that it's not as this one is not infected and this one is infected. So an internal hordeolum is that acute suppurative inflammation of the meibomian gland, an abscess. So this is an abscess عديل, while this one was just an inflammation, a chronic inflammation. هنا بيكون في pain or redness. تمام? So the difference between a chalazion and an internal hordeolum is just whether it's infected or not, and whether it's painful or not. تمام? في حين إنه sty is just an inflammation of the hair follicle. Okay, guys? You need to know the difference between the three. And usually none of them have a proper treatment. They're usually just like, what's the word? Supportive treatment. يعني بيدوك ممكن hot water compresses or just making sure it's clean and it goes away on its own usually. But if it persists, you might need like topical antibiotics in cases of an inflamed there. Okay? Okay, so yeah, infected here I hate this word so much. I am so sorry. Hordeolum. أما الكلازيون is not infected. Which parts do you want me to zoom? كده, is that better? Okay, thank you. طيب. عندنا تاني red eye. Red eye is such a big topic يا جماعة. بالذات في like if you get the extended matching questions, probably حيكون في سؤال عن red eye. So you need to be able to just identify which causes which type. تمام? I read eye عندها lots of causes, so many. فأنا I'm gonna try to go through them all like quickly just to make sure everyone understands a bit about each one. عندنا conjunctival causes. So if the conjunctiva is the cause of the red eye, عندنا conjunctivitis أول واحدة. Conjunctivitis is just the inflammation of the conjunctiva, and بتكون شكلها redness لكن it looks like injections or like red vessels. So انتوا تشوفوا الeye كلها بتكون red, بيكون في red lines كده ده. Why? لأن احنا قلنا الconjunctiva is clear except it has a lot of blood vessels. صح؟ if it's clear with blood vessels, الحاجة اللي بتحمر هي blood vessels ما الeye ذات نفسها. You'll notice like some people لما يكونوا ما نايمين كويس or something, it looks like their eye فيها redness كده ده خطوط حمراء. That's basically the conjunctiva. Okay? عندنا a few causes. عندنا bacterial conjunctivitis, عندنا viral conjunctivitis, عندنا allergic conjunctivitis, وفي a few others. Okay? So bacterial conjunctivitis, bacterial, is caused by Staph aureus or strep. تمام? And you know that staph and strep are known for being purulent, so they have pus. So they'll cause purulent pussy discharge. At treatment, antibiotics. So it's very simple. لو شفتوا pus, then it's probably because of bacteria or probably because of staph or strep. Well, answer is antibiotics. لو كانت viral, ما حيكون في pus، حيكون في watery discharge، حيكون في tears أو epiphora، حيكون في photophobia so they don't like looking at the light, they can't look at the light, it really hurts. الحالات دي عندنا a lot of viruses that can cause it but mainly adenovirus, herpes simplex virus و measles. Viral conjunctivitis ما عنده treatment because you just wait for the infection to go away and it goes away. So شايفين الفرق؟ Bacterial هيكون في pus and discharge like pussy discharge and in this case you'll give antibiotics. While viral هيكون watery discharge and you're not going to give antibiotics. تمام؟ Simple as that. في trachoma I'm going to skip trachoma, sorry. I'm going to go to ophthalmology, which is basically known as neonatal conjunctivitis. And this happens when the baby is born and they had already gotten this infection. And infections بتكون Neisseria أو chlamydia أو HSV أو herpes simplex. Like mainly the cause is chlamydia. Okay? Or like the common cause is chlamydia. So neonatal conjunctivitis or ophthalma neonatorum is just conjunctivitis in a newborn baby. And it's because of like the mother giving them the infection. It's usually chlamydia. Okay? لو كانت chlamydia أو Neisseria then the management هتكون antibiotics برضو. Okay? عندنا تاني acute allergic conjunctivitis. Acute allergic conjunctivitis الحاجة المهمة شديد فيها is that it's bilateral. The other ones are probably or usually on one eye only. Acute allergic is bilateral, always bilateral. تمام? And it's seasonal, so every single year بتجيهم. Every time بيكون مثلا something that causes them to be allergic بتجيهم. And there's a family history of atopy. So they either have asthma or they have dermatitis or something else. It causes itching. So that's another feature of it that's not common in the other ones, is that allergic conjunctivitis itches and the management is antihistamine. So مرات بيكون في برضه swelling و lacrimation and so on. Management is antihistamine. So this is pretty simple. Like the idea is just, you know the cause, the treatment makes common sense. الوحيد اللي a bit different is trachoma. Trachoma is an infection. And in Sudan, it is the commonest infectious cause of blindness. So it's the only, like, it's an infection, but if you don't treat it, you can go blind. So it's a very dangerous thing. It's caused by Chlamydia trachomatis. And it causes a lot of different, like, presentations. Like sometimes بتعمل corneal scarring, بتعمل subconjunctival. Oh, I think it's the same thing. I don't think there's a the amount I think is the only difference. Like lacrimation is just normal tearing and epiphora is when there's a lot of tears. Okay. Thank you. طيب التراكوما بتدينا like بتعمل subconjunctival fibrosis and بتعمل corneal scarring, and that's why as the time develops it eventually results in blindness. لأن الكورنيا لو حصل فيها scarring هتبقى you can't see. تمام. التريتمنت عندنا oral أو topical tetracycline أو erythromycin معاه azithromycin. Like I think you have to combine both, but I'm not fully sure. I haven't studied my antibiotics in a while, but I think you have to give both. I would prefer if you guys double check that. تمام. لكن basically it's chlamydia, so the management هتكون المانجمنت حقت chlamydia إنه tetracycline أو erythromycin topical ومعه azithromycin oral. Okay. فديل so far الكوزز حقت الكونجنكتيفايتس. عندنا تاني واحدة اسمها vernal keratoconjunctivitis. دي chronic allergic inflammation, so it's not acute, it's chronic. And it doesn't just affect the conjunctivitis, it also affects the cornea. الكورنيا بيسموها kerato, so keratoconjunctivitis. So it's cornea and conjunctiva. This is more common in young boys. And pretty much this is like a very يعني it's very specific شديد للكلام ده. itching watery discharge مع كلمة giant papilla دي. شفتوا كلمة giant papilla دي it's just a while automatically it's vernal keratoconjunctivitis. And it's usually very like بتكتب لكم في سؤال واضح شديد إنه young boy constantly عنده red eye عنده issues في conjunctiva, so redness, red injection ده injection look ده اللي هو like the vessels are the ones that are red. And they have giant papillae on examination. كده automatically it's شنو? It's vernal keratoconjunctivitis. تمام. I'll show you pictures before I go to the next stuff عشان ما نجي هنا. So دي أول حاجة. إن bacterial conjunctivitis you'd see the pus. You see pus on the eye. In trachoma فيه follicles like بيكون فيه these weird things on the lid, as well as إنه eyelashes بتكون downwards, بيكون فيه corneal scarring أو fibrosis. In دي vernal keratoconjunctivitis, these are the giant papillae, so it's really big, unlike الحاجات التانية. It causes giant papillae. These are what they look like on the lid. Can you see that? طيب. Baguette, there are pictures of them, so okay. So far, are we good, you guys? I'll try to go fast عشان again, like we try to get to the more complicated topics faster. So عندنا الpterygum ده it's just a fibrovascular growth. It's non-malignant and it's a triangular fold of conjunctiva. It does annoy people because it gives them a foreign body sensation and burning, and you don't do anything to it. It's just normal. It's like it's there unless الزول قال لكم they don't like it or they want to remove it or something like that. This is a pterygum, what it looks like. So it's just a triangular red part of the eye. So it's not the full eye that's red. It's just a growth, a non-malignant growth. If you want more cause, subconjunctival hemorrhage. So subconjunctival hemorrhage is basically that there's hemorrhage behind the conjunctiva. It's extensive bleeding under the conjunctiva. It can be due to trauma, sometimes even coughing, and it's spontaneous in the elderly. It doesn't affect the vision. دي حاجة مهمة شديد we need to talk about it, is that if the hemorrhage happens below the conjunctiva, the vision is normal. And we always have to check blood pressure to exclude hypertension. So your next step is to just check blood pressure, exclude hypertension, and it goes away on its own usually. Other causes can be just dry eye. So if the person has dry eye, they can have burning eye, foreign body sensation in their eye. And in these cases, you just give them droplets. And it could be due to injury or eyelid abnormalities. They can be causes of red eye. This is a subconjunctival hemorrhage. It'll just be like, looks like a hemorrhage under the eye. And the thing about it that's super specific is that it does not affect the vision. تمام؟ طيب ده الconjunctival causes. في تاني corneal causes. corneal causes عندنا أول حاجة corneal abrasion. So في trauma أو contact أو lenses. When you're wearing contact lenses, they can sometimes cause corneal abrasion. They'll scratch your cornea. It's a painful foreign body sensation tearing. A diagnosis هنا مهم شديد. We use fluorescein dye, and it looks green on blue light. So you put blue light and it'll turn green after you put the dye. And the treatment is topical antibiotics or NSAID. And sometimes in cases if it's being big, we need to patch it. Well, I'll show you what it looks like. So this is a corneal abrasion. شايفين? There's literally a cut. If you put the dye, the fluorescein dye, you'll literally see the cut on blue light. تمام؟ In تاني corneal foreign body, which is just any body inside the eye, هيكون في intense irritation and watery eye, and on examination you'll see the foreign body. In a corneal ulcer, and this is destruction / discontinuation in the cornea due to inflammation, and it's usually bacterial due to Staph aureus, can be secondary to abrasion أو foreign body أو حاجة زي دي. It's pain, discharge. هنا ده بيكون في decreased vision, and ممكن مرات يكون في pus in the anterior chamber. And if there's pus in the interior chamber, we call it hypopion. في تاني keratitis or inflammation of the cornea. It can be caused bacterial or viral. Bacterial is either Staph aureus or Staph epidermidis or strep pneumo. And it's again حاجة مهمة about all of the bacterial is that there's purulent discharge. يلا الكورنيا يا شباب, it's important for vision. هناك قلنا لما يحصل inflammation للconjunctiva there is no vision loss. لكن هنا ده when we're affecting the cornea, the vision is going to be affected. So هيكون في vision loss, هيكون في hypopyon, which is pus in the anterior chamber. You can see that the cornea is starting to get white. So الكورنيا ذاتها بيكون لونها white. في risk factors. Our risk factors are keratoconjunctivitis sicca or dry eye. Or if there was anything that affected the cornea or the corneal epithelium, like a trauma, abrasion, ulcer, الحاجات التانية دي كلها. أو prolonged contact lens use. أو topical steroids. Steroids can cause the inflammation of the cornea. تمام؟ الdiagnosis بنشيل scrapes from the ulcer، نعمل لها gram stain and culture. والmanagement هتكون antibiotics. Okay. في تاني viral herpes simplex keratitis. It has a specific like shape to it, which is called a dendritic ulcer. You'll see a dendritic ulcer on the cornea. A treatment is antiviral. So لاحظتوا بالي احنا قلنا في conjunctival لو في viral infection, we're not going to be treating it. لكن if it reaches the cornea, you have to treat it. ليه؟ لأنه it can be leading to permanent scarring, and in that case you'd have to graft. Okay, so the cornea is very important for our vision, and we need to be taking care of it properly. ممكن تاني يجينا viral herpes zoster ophthalmicus, which is basically ophthalmic shingles, which means that إنه الزول عنده herpes zoster and it was on the trigeminal nerve, the part that affects the eye, ophthalmic division, and it fully affects the eyelid itself as well. And this is super important. It's caused by varicella zoster virus, the ophthalmic division of the trigeminal nerve, associated with vesicles, lid swelling, iritis, and glaucoma. Super important نفتش الvesicles دي يا جماعة. If you can see the vesicles, so there's features of regular shingles ومعاها red eye، دي كده طوالي herpes zoster ophthalmicus. تمام؟ red eye لكن معاها برضو ال vesicles حقت الشingles أو حقت حقت الشingles. So المانجمنت topical antiviral وsteroids وantibiotics just in case يحصل secondary infection. في تاني protozoal which basically caused by amoeba. دي بتكون due to contact lens أو exposure to contaminated water or soil. فيها severe pain أو photophobia. دي المانجمنت I don't think it's that important. ركزوا أكتر على الفيرال والبكتيريال especially حقت الفيروس herpes zoster دي. وفي non-infective keratitis which is autoimmune. مثلا زي rheumatoid arthritis و SLE ممكن يعملوا keratitis. ممكن non-immune which is just it's called marginal keratitis برضو it's non-infective. So these ones just happen. Okay. عايز أركز لكم أكتر شيء على دي herpes zoster ophthalmicus أو ophthalmic shingles. You'll see on the face there's other vesicles و other features حقت الشingles. والآي ذات نفسها حتكون lid swelling وجوا الآي حنشوف الفيتشرز حقت الكيراتايتس أو الكورنيال opacity دي. Okay, إحنا نسي we're talking about mainly الكورنيا ذاتها it's covering the lens صح؟ يعني it's affecting الكورنيا is right on top of the pupil which is on top of the lens. So if you affect the cornea, you'll affect the vision. Al-conjunctiva is around its size, so it doesn't affect the vision. هنشوف other diseases that affect the eye, the vision as well, but mainly حسي so far corneal problems will affect vision. دي البروتوزول it has a very feature like a ring form feature كده معروف برضه. البكتيريال دي complete opacity. So yeah, basically they're the main ones. دي herpes simplex keratitis, the dendritic ulcer, which basically just looks like that. It kind of looks like a nerve, in my opinion, in neuron. So yeah, their appearance is like very specific. A corneal foreign body, you just see the body. عادي. This is the foreign body. Okay. عندنا تاني scleral causes of red eye. عندنا episcleritis وscleritis. Episcleritis إحنا sclera is divided to episclera or sclera. Episcleritis is usually idiopathic or infectious with the self-limiting. We don't worry about it too much. Scleritis though, we worry about it. ليه? You're gonna have to treat it or treat the underlying cause. I don't want you guys to worry about scleritis or episcleritis too much. We'll just move on. تمام. Orbital causes. So the orbit, the full eye يكون فيها مشكلة. عندنا orbital cellulitis, super important. ليه it's super important? And this is one of those emergencies. تمام. It's an eye emergency. Orbital scleritis بيكون في pain, lid swelling, and usually the lid بيكون fully swollen, the full lid مقفول شط. في bulging eye. diplopia ممكن يكون double vision لو الزول بيقدر يفتح عينه أو في العين التانية. بيكون في fever. If it doesn't get treated بيكون في vision loss. تمام. It can arise from the ethmoidal sinus. So بيكون في some history of some other infection, tooth infection, face infection, حاجة تانية كانت حصلت قبليه. And it's an inflammation of all of the layers of the eye. That it's an emergency, and you guys have to be able to tell what orbital cellulitis looks like. Like, look at that. بيكون ال eye very inflamed. بيكون ال eye very red, super painful. It's a very dangerous condition. تمام. Scleritis or episcleritis is just, it looks red like that. It's not that big of a deal as much as orbital cellulitis. تمام. في برضو dacroadenitis, which is just inflammation of the lacrimal gland. Not much you need to know about it. في anterior chamber causes, which is basically عندنا hyphema أو blood in the anterior chamber. It happens with trauma. عندنا acute congestive glaucoma, نتكلم عنها later. عندنا uveitis أو inflammation of the uvea. Not that important either. Important anterior uveitis. So anterior uveitis اللي هو iritis أو iridocyclitis. Sorry. دي هي basically the idea is إنه iris is the part that's like mainly affected. تمام. Because of that, you just gotta know that this is so long. Sorry. طيب features in ocular pain, photophobia, blurring of vision, hypopyon. And again, the iris is part that's responsible as well. قبل lens, and it's important for your vision. So if it's affected, it's gonna affect your vision. Mainly دي المهمة, because this is probably the one you're gonna see the most. If you remember, لما you're in medicine, you'll see it a lot. إنه a lot of these diseases, sarcoidosis, behçet, psoriasis, inflammatory bowel disease, writers, ankylosing spondylitis, and so on, they are highly associated with uveitis. This is where usually the question بيكون. الquestion بيكون بيتكلم mainly about the features of some of these systemic autoimmune diseases, and it brings up a systemic disease. Oh, sorry, it brings up a red eye معاهم, and the answer هيكون uveitis. There are a lot of causes. There are a lot of features as well. I'm not gonna be going into details with this. هنبدأ like once the it has a irregular shape of the pupil. That's one thing like you guys gotta remember. In the iridocyclitis, واحدة من the features is irregular pupil, like you see there. It's very clear and very obvious. I think الزوم هيقطع, so لما يقطع هنخش تاني ب the same link, I hope. If it's not the same link, I'll let you guys know, okay?